People who lose limbs to disease can suffer an intense emotional loss as well. A new service is helping people cope with the after effects of amputation. Rod Starns has details in our cover story.
For the McKees, their trips to Baptist Rehab Germantown began because of an ingrown toenail. Gene McKee's right foot became infected, with the infection spreading up his leg. The leg eventually had to be removed at the knee. Shortly after that, the process repeated itself in his other leg, so it was amputated too. But rather than making trips to see various medical and prosthetic experts in several places, he meets once with his entire team at Baptist.
It looks good. Rather than going to one physician to address one issue and then maybe going to a physical therapist for another issue and a prosthetist for another issue, we found that if we bring everybody together in one place, it makes it much easier for the patient. They can have all of their issues addressed in one setting and then have a resource where they can call if they have questions and certainly come for follow-up.
Dr. Jane, who is a physiatrist, a rehabilitation physician, says the Baptist Rehab Amputee Clinic is unique, using the multidisciplinary approach to helping people cope with the after effects of amputation. McKee says having two artificial legs takes some getting used to, but he's managing.
Balance has been the biggest thing. Learning all about my balance, like I tell everybody, 90 years ago I was learning to walk. Here 91 years later I'm learning to walk again.
People can suffer from phantom pain where their limb used to be. Other times they may try to get out of bed, forgetting the limb is no longer there. An amputee's rehab team comes together shortly after surgery to help people identify and deal with whatever issues they face.
And we look at what the issues are. So a patient may come in, they may obviously have had the surgery, they have issues with pain, they have issues with their medical management, they may have weakness, they now have to learn how to get around without a limb. So we kind of start from the very beginning.
In the Mid-South, amputations are commonly the result of complications with disease. Blood flow to limbs can be affected by out-of-control diabetes or vascular disease. There are also traumatic amputations, when injury leads to the need to surgically remove a limb. Care is tailored to help patients regain as much activity as possible.
They made the final adjustments just yesterday on my left leg, which makes me capable of walking smoother.
The main goal of the amputee clinic is to help patients maximize function. That is, they determine what a person wants to do and is able to do. It can be as simple as getting around the house, or for younger amputees, as challenging as competing in athletics.
One of the key factors in all of this is really understanding what the patient's functional goals are. We really ask them what do they want to be able to do. What are the things, both from a day-to-day kind of issues, but also in terms of their hobbies and their interests.
McKee says he's about 80% to where he wants to be. No kneeling, though. He says it's too difficult to move for him now. He's progressed from a wheelchair to a walker and expects to be using his cane soon.
And now I guess I'm progressing pretty good. I can motivate it a little bit. My next step is to walk without any assistance.
That's for the short term. Eventually, the 91-year-old wants to get back on the golf course. His medical team believes he's got a good chance of getting there. For Smart Medicine, I'm Rod Starns.